your brain is going to pay attention to what you look at, what you're wanting to pay attention to. So if we're letting it just automatically pay attention to whatever, and it's noticing pain and pain and pain and pain and pain, you're kind of hardwired to see it.
You just heard Leah Lopeteguy with Inner Beacon Therapy. Leah Lopeteguy-Hoffman is a licensed marriage and family therapist, also licensed as a clinical counselor. As a jack of all trades and ace of one, Leah has been able to utilize the knowledge and experience gained from her employment with the service industry to work with diverse populations, including seniors, aging adults, students, families, spectrum disorders, law enforcement, and veterans. Leah currently works in private practice where she continues to engage with clients promoting positive change and compassion for all. Her most recent accomplishments include certification in eye movement desensitization and reprocessing, also known as EMDR, and becoming an EMDR IA approved EMDR consultant in training. Leah is a lover of learning and continues to expand her growth in the field of therapy for the benefit of those she serves. Leah holds a Master of Science in Counseling degree from the University of Phoenix, Bachelor of Arts degree in Religious Studies from California State University of Bakersfield, and an Associate of Arts degree in Liberal Studies from Bakersfield College. She lives here in Bakersfield with her charming, I don't know about charming, I know Patrick pretty well, but I'll give him the benefit of the doubt on that. Charming husband Patrick, their 6 children and their cat. Get a little of this, Gracie Lou Freebush. So today was an interesting episode. We discussed the stigma surrounding mental health, and I found it to be very eye-opening. We talked a little bit about how that can differ between, like your family to your neighborhood, to your city, to your state, and how those stigmas can change between ages, between sexes. And it was just fascinating to see someone so passionate about mental health and, sounds like doing her best to get rid of the stigmas that for some reason a lot in our society hold. We talked about a interesting treatment, EMDR, which stands for eye movement desensitization and reprocessing. And I did my best to ask questions to learn about it because it was very technical and obviously well above my experience and pay grade. But nonetheless, she did a very good job bringing it down to my level. And I encourage you to listen to that portion of the show specifically, as it was, at least from my perspective, very, very interesting and intriguing. I do have to read this medical disclaimer, and that is the information found in this podcast is not a substitute for help from a licensed mental health professional and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified health care provider with any questions you may have regarding treatment of a health condition. Never disregard professional medical advice or delay in seeking it because of something you have heard or read on this podcast. Enjoy the show.
Welcome back to the Our 2 Cents podcast, the show where your local professionals sit down with an array of guests to hear their story and impart some wisdom for both business and life-improving skills. This is your place to hear business and community leaders discuss relevant topics that matter to you.
And welcome back to the Our 2 Cents podcast. My name is Kyle Jones, and before we get into today's episode, I want to encourage our followers to sign up for our newsletter. Shannon's been working very hard at revamping it and provides a lot of good information about our past episodes and what to look forward to. Leah, we are happy to have you today. How are you?
I'm very well. Thank you for having me.
Oh, my pleasure. Before we get started in your kind of career, I want to ask you a general question about your recently new business, right? You recently incorporated, correct?
Yes.
And before that, you were acting as sole prop, or what were you doing in that capacity?
Sole proprietorship.
Okay. Yeah, I say sole prop because I'm used to abbreviating things. So talk to me a little bit about wearing the hat of a licensed professional versus being a entrepreneur / business owner. There's
so much to say. It's probably hard to know where to start, but there are very big differences, obviously, with the legal aspect.
Right.
But as a sole proprietor, just as an entrepreneur, right? There's all different kinds of business things that go into it. As a therapist, I wear many different hats. And so from the sole proprietorship, not a whole lot has changed other than just the legal aspects of it. And even, some of my legal forms need to be updated, but I still wear the same hats. And so I'm a therapist part-time is what it feels like. And then the rest of the time it's a medical biller and I'm a receptionist and I'm fill in the blank.
Yes. And so obviously you could be a sole prop, you can be an LLC, you can be a corp, you can be a professional corp, limited partnership, all these various entities you can be, but all those things are really, you're a business owner, right? You're an entity. So I guess what I meant to ask, maybe I didn't ask it well enough, is your hat as a licensed professional, and then also your hat you wear as an entrepreneur, whatever entity that it happens to be. How do you balance it? How do you balance the time? Is it 60% as a licensed professional? Is it 40% as a business owner? How do you break that down?
My first instinct, the first thought that came to my mind was flying by the seat of my pants. That's pretty much how I manage a lot of these things. And so, yeah, with a licensed professional, because I have 2 licenses. And so they're both governed by the state of California Board of Behavioral Sciences. And so I've got legal requirements as far as that is concerned in order to provide therapy. That portion going into a sole proprietorship or corporation, there is, I'm used to historically working with other people. If I have a question or best practice, we call it in the field, is checking with other people in your area to make sure, am I providing what typically type of service or treatment would be provided? And so adding on the entrepreneurial aspects is the additional layers of that. And so managing it, I don't know if it's a 60-40 because it feels like every single aspect I have to put. It just depends on the day, actually.
Do you prefer one or the other?
Individually, I like all of the pieces of the work that I do. I can say with an exception. The medical billing part, not my favorite. It's just the paper, it's how you pay the bills.
Right. It's important.
It's super important. And so there are so many different aspects about that it took me, definitely not an expert, but it took me a couple of years to even figure out the finite details of that, because there are legal requirements as far as HIPAA, high tech, and how you can communicate information. And that's part of my licensure as well. Yeah, I guess. I hope I answered that question.
No, the reason I asked that is because me personally, as an attorney, I love practicing law. I love meeting with people. I love clients. I love, each case being this new type of job, really. It's kind of how I look at it. But for me, the exciting part about kind of work every day is the entrepreneurial side. I like running the business side of my practice. I enjoy that. It's funny because I talk to a lot of attorneys like, I wish I didn't have to advertise. I wish I didn't have to pay bills, like payroll stuff. Like I hate all that. I just want to practice. And to me, I wouldn't be happy doing that. I wouldn't be fulfilled if I went to a big firm and just clocked in and worked 80 hours a week doing quote unquote legal work. I think I'd get burnt out pretty quick. So I was wondering if that kind of helps balance it out for you.
Yeah, I definitely relate to that because I think it's the moving pieces that keep me engaged, and that I actually just started to share one of the things that I had developed for myself, because I have a 10 to 20 minute task folder and a 25 to hour long task folder. And so sometimes, just depending on the day or how the schedule goes, right, I'm looking for, I know what needs to be done by the end of the day and then by the end of the week. And so fitting some of those things in has been complex. And so identifying, okay, I've got 15 minutes right now to use my brain power to focus on something. What is that going to be like? And that's been really helpful for me too, to make sure that all of the pieces are kind of tied up by the end of the day.
That's an interesting tool. And that's kind of the cool thing about talking to people on this podcast. You learn so many new things. And I've never heard somebody explain time management in that way, or maybe how to focus your time. Pretty intriguing.
Thank you. I also color code things. So I have a couple of different, I wish I had them with me, but they're Post-its. And so they're the different colors. And so one's for business, one's for personal, one is for client work that I need to do. Say I need follow-ups, or I need to send out some forms or what have you. It's the way I keep myself organized. It's quite literally like playing chess on a table with my, what do I have to do today?
That works for you, obviously.
It works for me. It probably for, other people, like my best friend, for instance, I know she would look at it and go, oh, that looks like chaos.
Right.
What are you doing here?
But you figured out how it worked for you. And so whoever's listening may want to implement that or try it and be like, that doesn't work for me. Or someone may try it and say, hey, that's a great tool.
Anything that I have struggled to find, please, here you go.
Yep.
Absolutely.
100%. Okay. So you mentioned earlier you have 2 licenses, correct?
Yes.
Can you describe each one? I know that you said they're both governed by the California Board of Behavioral Sciences, but within that, there's different licensures, correct?
There are. And so my first license is licensed marriage and family therapist,
okay.
LMFT. My second license, which came a little bit after, so there were some different, I was part of the donut hole graduating class. So the LPCC license, which is a licensed professional clinical counselor,
okay.
that passed governmental laws and what have you, and got added to the list of people as providers for mental health services. It's got its own kind of classification, but basically there are 3 major ones. So LCSW, licensed clinical social worker, LMFT, licensed marriage and family therapist, and LPCC, licensed professional clinical counselor. And we all do, very similar things.
So you have 2 out of the 3.
I have two micro, macro, and meso systems is how I think of it.
Okay.
And so with marriage and family therapy, that's its own kind of I work with individuals, but I also work under the understanding that there are multiple different things at play, not just what's going on with the individual. And the professional clinical counseling, I brought that in because when I graduated, it was an option. Do you want to continue going to school and get the second license at the same time as, completing the hours for the first one? And so it just seemed, I love learning. It's like my favorite thing ever. I think that's one of the things, side note, one of the things that I really love about the work that I do is I get to learn about other people. And so adding that extra year to what I had to do was, okay, well, I'm going to do it anyway. So I might as well double count it and see where it goes.
It was worth it for you, obviously.
I really enjoy both aspects. So I do peer consultation with other people in the field, and just recently started to include peer consultation with my second license, LPCC, and the community. It's just, we Zoom. And so there's 4 or 5 of us, just depending on our kind of specialty, if you will, and just getting feedback, what they're doing, what their struggles are. So super normalizing, but also they've gone through the same academic rigor. And so they speak my same language, and it's nice to hear in a forum what they've gone through, what their, struggles have been, or what their strengths are.
So do they overlap at all? Or they part of your practice one, part of the other? Or is it kind of like all?
It's a really good question because it's both. Yes, there are some differences. And just recently, there were some laws passed that removed some of the barriers for the second license, LPCC, which was huge. But there used to be a requirement that in order to have this LPCC license, you also had to fulfill qualifications over here on the MFT side. If you wanted to treat children or if you wanted to treat families or couples, you weren't allowed to do that with that second license.
Okay.
Without extra steps.
Okay, so the acronyms are, I guess, what's throwing me for a loop. I'm good with my own acronyms that I work with every day, but apparently not yours. So someone who's listening who has no education or experience or training in this field at all, what would be a simple way to kind of describe? I mean, like people understand the term counselors, people understand the term psychologist or psychiatrist. Like, how would you kind of paint your box, if you will?
So my box, because it's got the two that they overlap, and same governing body, same expectation, same legal requirements. Still, as a therapist, I know that there have been some distinctions between therapists and counselors, and sometimes they're interchangeable. Just like historically, people like clients, I call them clients, they used to be considered patients. Lots of different changes went into that, just like for the 2 different licenses. So for my box, I'm a therapist. The things that I do are mental and behavioral therapy.
Okay.
Diagnosing, so identifying what it is that's going on. And once we identify what are the symptoms, then, and that's for both. So with my LPCC and my LMFT, they're interchangeable as a therapist.
So can you prescribe, I think I know the answer is, but can you prescribe medication?
No, I never want to do that.
Okay.
It's definitely something that is somebody else's skill set, and I'm thankful that there's somebody else to do that. And I work with a couple of different professional psychiatrists in town, not directly, but that I really like their style. I really love the way that they're conscientious and they're considerate. And there's a lot of different things because I spend 50 minutes with somebody, sometimes 2 or 3 times, even 4 times a month. And then the psychiatrist is seeing them every maybe 3 months. And so I have perhaps sometimes a little bit more information that I can add to the clinical picture that can help, but definitely not my scope.
Okay. And so are you, not be a loaded question, are you anti-medication for mental health issues or?
Not at all.
Okay. So there is a purpose and place in that for that in your opinion.
Absolutely.
Okay. Because they do have a lot of benzodiazepines there's some pretty serious and heavy medication. So there's a lot of people who, I guess, abuse them. There's a chance that they get in the wrong hands, and they're very powerful drugs. And so I was curious as to someone in your position, whether you think those are like absolutely necessary, they're dangerous, or need to be in good hands. Like I
definitely think that having a good relationship with your prescriber, no matter who it is super important, because they're going to do the same thing. They're going to gather a bunch of information and kind of a snapshot to be able to put together, okay, what do we think would be best? And I also, in working with my population and the clients that I see, some people, they don't want to take medication. I can completely understand that.
Sure.
I really can. And I'm a huge client advocate. And so I want to advocate for what works best for you. If there are situations that we are recognizing, though, that some of the symptoms are just unmanageable, perhaps, that's when we're talking about, okay, do we need to see if we can just at least have a conversation with the prescribing professional to tell them a little bit about what's going on and see what their thoughts or suggestion or evaluation would be.
Okay, so if I'm following the bouncy ball, so to speak, someone comes to you, you treat or diagnose and then treat with therapy, right? And then if that is not sufficient, then maybe the next step would be to go to someone to prescribe a medication, or does it kind of work simultaneously?
There's a lot of information that goes all different kinds of ways, but the one that I deferred to, and it's not just because I like it, because there's a lot of evidence behind it, studies, and this has been time honored, is that when somebody's prescribed a medication and they have therapy, they have the most successful outcomes. So it's a combination sometimes of the two, but that doesn't mean that it's exclusively like that.
Okay.
And so also sometimes it is somebody goes to the psychiatrist first, and so they have their prescription and then they're referred to therapy. So it can go either way.
So I'm trying to draw an analogy with something that may be more familiar to people, haven't really dealt with the mental health arena at all. Like going to, say, a medical doctor, right? And they say, okay, you've got X, and then they can prescribe you a prescription for it. Or you can say, you know what, instead of that, I want to try to go maybe to the physical therapist and or a chiropractor and work things out without having to take medication. Is that at all a kind of similar analogy, or?
Very similar.
Okay. That would be my initial thought for me personally. I would want to go to someone, I guess, more on what you do initially, because getting on prescription drugs they scare me. I don't like to take Advil personally, but so that me personally, that's scary. So do you have clients who come to you and say, look, I need help, but I tell you what, I do not want to take anything, and I'm here to get help? I
do.
Okay.
I couldn't think of how many perhaps, but yeah, throughout the years, I've had quite a few people say that's just, and for, their own individual reasons, but just like you described, there's a fear factor. There's a fear of the unknown, right? As human beings, we have very little tolerance for the unknown. And so knowing how that fits with your system or your body, or if you've had experiences in the past where medication has been not the best thing for you, for one way, it could have been even an antibiotic or an adverse reaction. I completely understand that, and how there would be all different kinds of variables involved. And let's start somewhere.
Okay. So I think that I got that. That's explained very well. And I think I understand that. Do you think, this is going to go back to a broad question, and I was kind of wondering from the beginning, do you still think there's a stigma behind mental health in our society?
Big time.
Why is that?
That's a very good question.
That's why I asked it.
I wish I had all the answers. There's my magic one.
You're obviously, caveat, your opinion only. I'm
yeah.
not expecting a crystal ball here. But.
I appreciate that.
Yep.
And honestly, I think that there are so many different things that go into it. There are cultural aspects. There are, and when I talk about cultures, it's not just different ethnicities. It is also, we have cultures within our cultures. The way I describe it to people when I'm doing like the first assessment, I'm getting to know you, when we're talking about culture. One of the things is, right, you've got your family culture inside your house. You've got your street culture, perhaps in your neighborhood, right? Then you've got your city and your town's culture, and then your state's culture, and then so on and so forth. And so there are so many different aspects that kind of overlap the mental health stigma. And that's also a barrier that's preventative for people reaching out when they recognize, look, I've had this going on over and over and over. I've tried all of these different things and I'm out of tools or resources, and there's a stigma.
Do you think that the stigma is because of it's unknown to a lot of people? They're unfamiliar with it?
That definitely, especially with the various unknowns.
Yeah, you talked about that earlier. Yeah, because, if I were to walk you out of the office here after we finish this podcast and I trip over something and snap my ankle, I have no problem going to a doctor and say, my ankle's broke. Can you help me fix it? I'm just wondering why, if there's a mental condition or issue that you're having that's, I don't want to say broke because it's not like a physical break, but damaged or need of help, however you want to describe it. I wonder why there's a stigma to getting help for that versus getting help for a physical injury in our society.
Again, there's so many different, and I think that's a really good point. Why would I, right? If I injured myself physically, why would I not, in a way, the thing that I think of like a car, you get a tune-up on your car, right? You get a physical health wellness check, right?
Yeah, I get a physical every year.
And do we check in on our mental health?
Never.
Yeah.
I'm answering your question. Yeah. I'm not saying.
And so going with that, the mental health stigma, sometimes also people think, well, that just means something's wrong with me.
I guess it goes back to thinking like what constitutes normal, right? I mean, maybe if I had an open conversation about everything, you'd be like, yeah, you got some things to work out. But in my mind, maybe I think, well, that seems normal to me. Maybe people aren't really aware of what to look for. Again, going back to unknown or uneducated, maybe there's not seeing things that may be socially inappropriate or whatever it may be. Maybe there's just not something that's registering. Do you think that could have anything to do with it?
It could sometimes, and that's the thing, going back to normal, what is normal? It's
Right.
a spectrum and we all fit on it somewhere. And so if it starts to feel not normal for you, that's where
Subjectively, not objectively. Yeah.
Right. And so just like physical health, right? If you have a cough and you've got it for, a couple days, doesn't mean you're going to go to the doctor for it. But if it lasts a lot longer than that, then it's, we want to make sure we prevent a problem from happening or it getting worse or becoming an infection. And so I feel like mental health kind of fits into that same kind of pattern. Okay, well, this has been going on, right? Everything was okay. And then all of a sudden, and then we're starting to notice that there's all different kinds of other things that are impacted. And so being able to recognize that, simple things like emotions. The majority of us have about 7 words for, I think there's like 50 plus emotions. We call them feelings for a reason because we've registered them in a body
Right.
with our senses.
Right.
And so when those are showing up and people have not had an experience of perhaps what it is that they're feeling, then what is it, right? There's a fear factor. What is that? Is something wrong with me? What is this that's going on? And oftentimes, and historically working with even small children, when you can give them language for what it might be that they're experiencing, it makes it a little bit more manageable.
Because you can explain it. You can talk about it.
Yeah.
Right.
You can put words to it.
And help you understand it, I guess. Do you notice, and obviously these may be generalizations, but is the stigma different between, say, a man and woman or from younger versus older? Have you noticed any distinction in those groups or groupings?
Yeah, I think that there are probably layers of stigma. So with, yes, culturally, but also socioculturally, right? With men who historically haven't been necessarily taught that their emotions are welcome, that they're okay, that is a part of being a human being. There's bound to be stigma with that. Law enforcement, veterans, these are different various populations where it's kind of built in that you just kind of rub some dirt on it and get on with your day.
Right.
Yeah. And that is, I always talk about, all of my clients hear this from me. When you shove emotions down into the corner, it's like putting baby in the corner. And what happens? She comes back out fighting.
Right.
And right, that's where the stigma kind of...
And holds true. I think when you see people get to a breaking point, it's probably because they've done exactly that, right? Just kind of push them back in the corner and not deal with them. What about age? Do you see younger people more willing to get help than older people?
I do. And it's such a great thing. And I have such hope for, these up and coming generations because they are able to recognize, oh, this isn't right. Something's wrong. I'm not feeling good. I'm not feeling my best. And they are willing to reach out. I think that there's, pros and cons with everything, but with social media, and I hear a lot even from clients talking about, oh, I found this on TikTok, which sometimes there's really good information. It's a little bit like when you're doing research, don't look just at Wikipedia, just, for the references to see where else can I look, but same kind of thing. I noticed with a younger generation with probably my 18, 19, 20-year-olds, the millennial generation, they are more apt. It doesn't seem like, I wouldn't say that the stigma is gone, but they are having dialogue about it.
Yes.
They're talking about what they're experiencing.
And I've noticed that personally, not even in that age group, even younger, like even high school age or in, the teenage years, I would say.
Yeah.
I see people and maybe family members that I've seen actually talk about, this is Mental Health Awareness Month, or engaging in that type of discussion, where when I was that age, I would not have a clue not that I would think it's bad, but I would have no idea that it even existed. So I think you are seeing people engage in it more, I guess, which is a good thing. But I'm wondering how much that has to do with social media, as opposed to people at that age are actually more aware of mental health and maybe want to actually get some assistance in that. I don't know if you have an opinion on that or not. I mean, social media seems like it's a great tool for that. But.
It definitely, pros and cons. It can be a really positive tool for normalizing people's experience. When we start to, when we all get in a room and we start to share some of the things that are going on with us, and we start to recognize, oh crap, me too. And so... Right,
I'm not the only one.
It not only normalizes it and give you a really good reset. And so, that says a lot about what is going on for some of these younger generations, these kiddos, that is part of now their dialogue, and that they're understanding it more, and that it's starting younger and younger. And it's very promising.
So, personal question for you. You can share if you want. But what is your, It's like a two-part question. One, you talked about marriage and family counseling. Do you feel that's something that every married couple should do on a fill in the blank, monthly, yearly, 5-year, decade, whatever it is?
Like a tune-up?
Yeah. Do you feel that's absolutely necessary?
I don't know that I get, so it's a slippery slope when we're talking in absolutes, all or nothing. But I definitely would encourage couples that are engaged, starting from there. Let's get on the same page about some of these things. Let's work out some of these details, because as we become parents, we want to make sure we have, similar morals and ethics, and that we're a unified team, that we're co-parents. And so getting ahead of it, that would be, ideal. I would encourage anybody.
Before marriage, it's highly recommended to actually take that step. And I know you said you don't want to get into the world of absolutes, but to me, I think anyone who's, over 35, 40, I would say, hey, it's pretty imperative that you'll get a physical every year, right? Not too much downside to it, be preventative in many circumstances if you catch things ahead of time. So I would say that is pretty absolutely necessary if you want longevity and health in your life. So I'm going to challenge you. Do you think it is necessary in an absolute sense for couples to work on their marriage from a mental health standpoint?
I think it doesn't always require a therapist.
Oh, okay. How else do you...
I am also a research nerd.
Free advice here.
Yeah.
I
get it. No, you're good. So, there are so many different things, because we go through ebbs and flows just as one individual human. It's bound to happen as a couple too. And so there's all different kinds of support for that, to make sure that the longevity is there and that you are, I call it returning to center. So I come back to the center and I take a look, and I'm putting in the work that's on me. So it's 100%, right? And you've got 50% and I've got 50%, which in reality is actually, that's not always how it goes. It would be lovely, but sometimes I come home and I've got 20% and I need help, right? And if we're both at 20%, what's the negotiation then? Because then total, we've got 40%, and we need at least, ideal would be 100.
Right, something higher.
Yeah, right. Something higher. But couples therapy, family therapy, that's not something that always requires a mental health therapist. It's when you get stuck.
When you stop trying, or I guess when you...
Well, yeah, maybe it doesn't even have to be when we stop trying. It's when we've tried to solve whatever it is that's come up between the two of us, our brainstorming, and whatever tools we've used, and we've exhausted those tools. We need some feedback.
Gotcha. Like a new set of eyes. Like, okay, we try everything we can. Let's bring in a professional, so to speak. Why not bypass that and start with a professional? I'm just asking this because from a physical health standpoint, right, you have longevity, right? But you also have quality in that longevity, right? You could live a long life, but shitty, right, on a bunch of medication, can't walk because you've got, an unhealthy lifestyle or life. And you could have a long marriage, and you could either be happy in it or you could be unhappy in it, right? So why not start with a professional from the beginning if your intent is to have a long, healthy marriage?
In my perfect world, and I always talk about my perfect world, I know your listeners can't see this, but it's over off to my right. I'm circling with my hand.
Yeah,
right? It's over here. And it's over here because I don't always live there.
Right.
I get to dip into it and I get to build the picture I want to see. But, why not start with it? Why not start at an early age? And this is like your family doctor, right? You've got the family therapist. In my perfect world, that would be the normal component, because we would be working together, right? We know that there's a brain-body connection, that it's top down, bottom up, and all different kinds of things that go on in between. And then again, in my perfect world, every medical office would have a therapist in there that can be able to, actually it was my very first experience of working directly in therapy as an intern when I was finishing grad school. And the model that they had was a comprehensive care center.
Interesting.
It was brilliant. It was brilliant. They had the nurses, they've got their MAs, they've got their social work team, their palliative care team, their therapist, which I was the therapist.
Yeah.
And it was just a dynamic. So if there was a situation that presented in the doctor's office, the doctor would send for me to come in and do, an assessment. Let's make some determinations really quick to see, how can we best help right now?
That I can see why you say that's a perfect world, because that's a lot of resources for 350 million people, or however we have in this country. That'd be pretty hard to have a complete wraparound service for.
Would it? No.
I don't know. Would it?
I don't know.
You think it's possible?
Well, health and longevity is what we're going for, right? And
some people. No, I mean, I don't think everyone has the same outlook that I have, or you have, or maybe someone else that we know has. I mean, I just don't think everyone thinks that way. Otherwise, I mean, everyone would be at the gym, right? Doing some sort of exercise, right? Whether it be going on walks or swimming. But a lot of people don't. I think people wouldn't be eating McDonald's if they had longevity and health in mind. I enjoy some wine on occasion. I probably drink a little too much if I really wanted to be optimal health-wise and longevity-wise. So I think we're kind of our own, I don't want to say critics, but we kind of self-destruct a little bit. And so I think that's why it is hard, because you can't force people to want to do that. But in talking to you and hearing you explain these things, to me, it makes sense if you want to be proactive and you want to have a long and healthy marriage. For example, what we were talking about, you would absolutely do that every year like you would go to a physical. To me, it just makes sense.
Yeah. Well, and I wish that therapy was like a physical. It's a little different than that. And so, if we went in for mental health tune-up, what would that look like? There is such a thing as brief intermittent therapy. And that's actually over the course of a lifetime. I feel like that model it would fit really nicely within the medical model.
If it was consistent?
If it was consistent.
Yeah.
If it was, that you go to your doctor, right? And your doctor, right down this in the same office, you've got your therapist. And I'm going in for my physical and I'm just recognizing, holy moly, I just got sick. Can I just go down the hall and talk to the therapist real quick? And then we make an action plan roadmap of, okay, in succession, what can we do? What can we get done? Maybe it'll take longer than that, but maybe not.
Yeah, that's obviously a question that you have to answer. Is that something that could be done in a part of a 1 hour or 2 hour visit and then you don't see him again for a year? Because it seems like there needs to be maybe some follow-up or some accountability. I don't know if you think that's a doable model.
So your primary care physician, and, I know that there are other, different various types.
Specialties.
Yeah, specialties. Right. And so that's where, there's so many different moving parts because, it would be great. 1 hour assessment. Let's make a determination. Let's make a plan of what it is that we're treating first and what it is, how are we going to go about it? And then moving forward from there. But I don't know that it would be like a once a year kind of tune-up.
Because I was thinking the tune-up approach, obviously if you go get a physical and you do an EKG and your primary notice something, well, they're going to send you to a cardiologist, right? Or they see a growth on whatever they're going to send you to, whatever. So I guess I'm just thinking out loud if the model of having, or like, even if, like a dermatology appointment, right?
Yeah.
As you get older, it's probably advisable to go once a year, check out your skin, see if there's anything growing that's suspicious and take a biopsy if need be. And otherwise just, hey, I got a year of health checked off behind me. I wonder if there's something similar with just like a one visit, whether it be in a half hour, 45 minutes, hour, whatever it takes to work on that aspect of it as just like like you said, a tune-up. Like that seems like a reasonable model. I mean,
It seems like it would be a reasonable model. I feel like though, because therapy is different, right? When you go to your doctor and they spot something and they want to refer you out, sometimes you're going, so let's say digestive disease, doctor. Mm-hmm. And so you're referred there for something, they're going to do some tests, they're going to rule it out, right? And then once you're done, you go back to your primary and keep an eye on it.
Right. So if there's something wrong, then obviously you need more follow-up or referrals to somebody else. And like you said, if you're stuck on working and you want to go see a professional, it's like, hey, we're having this issue, I need some help, and so we come to see you. That makes sense. I'm just wondering if there's a way to add what you do as part of and hopefully there's nothing really wrong, right? Just something that maybe just kind of check in. Is that something that, am I missing the concept behind therapy where once you come in and check in, and hopefully, like most physicals you go to with your primary care, you do the blood test, you do the EKG, piss in a cup, blah, blah, blah. Everything's great. We'll see you next year, right? So is there a way to like incorporate or that model of just kind of checking in and making sure everything's okay? Maybe that's a preventative. How about that? A preventative therapy session.
I think that's already, I feel like I build that in personally, but that's after somebody has already found me, been referred to me in one way, shape, or form, or we've initiated therapy. And so...
Is that because there's a issue they need worked on or fixed?
Typically, because we're building a relationship just like you would with your primary care physician, right? You want to know that you can trust the person, you build rapport, you're sharing really honest, vulnerable things about your physical and mental health. And so having that relationship and knowing 5 years from now, holy moly, I'm in a stuck place. What do I do? Well, maybe let's give Leah a call and see.
Right.
And that is huge. I love that. I love to be able to plant that seed for people. Going back to making it, an annual mental health checkup. Yeah, perhaps people can start doing that on their own.
Right. That's what I mean, on their own, not referred to you or
you're recognizing. So even within the medical model, if we look at, there's a study called the ACE study, and it's actually some questions that you can ask, and starting there with your medical doctor. I would hope that every medical doctor, it was actually a study that was done by Kaiser, it was completed by Kaiser, adverse childhood experiences and how that affects.
Interesting.
It'll change your genetic code.
Really?
The higher your test, the more likely right? Not causation, but definitely correlated. And some of it they're finding is causation, so that they're recognizing that the higher the score, the more likely you are to have hypertension, high blood pressure, cardiac issues, lung issues, diabetes, right? Some of these very complex physical health problems are stemming from adverse childhood experiences.
And that's something that these questions are being asked by primary care physicians?
I would hope that they would.
I've never seen that before. That's interesting. I'll have to talk to my doctor about that. So is that something that you would do if someone came to you literally and said, hey, I think everything's cool, but I just want to kind of maybe get a checkup mental health wise, and would that be a test you would give them? Or
well, it's not necessarily a test. It's kind of a yes, no.
Okay.
And so it adds up to a number, and at the end of the day, the higher the number, right? And it would be a really simple way to gauge, oh man, okay, well, do we need to look at some of these things and make sure preventatively that we're addressing them, because we know it's changed the genes. And
that's so interesting.
It is very interesting.
And I'm wondering if, because as I'm playing this out in my head, a lot of people, especially men, sometimes don't go to the doctor because they don't want to know what's wrong, right? Like want to kind of bury their head in the sand. So I'm wondering if it's maybe people would have the same outlook with going to get just a checkup, right? Or just a tune-up from a mental health standpoint. Like, well, maybe I don't want to do that because I'm afraid something.
Don't tell me something really bad.
Yeah.
That fear of that. Oh, they're going to tell me I'm broken.
Back to the unknown
everything.
again, right? Yeah. But I guess then it's just like anything. Then it becomes a function of who you're seeing and whether or not you trust and have a relationship with that person, right? Because I could tell you there's really good attorneys, there's really bad attorneys, there's good physicians, there's bad physicians, there's probably good therapists and bad therapists. And if you're seeing a bad therapist, you probably wouldn't want to continue seeing that person. So hopefully you have the wherewithal to figure that out pretty quick.
Well, yeah. And typically what I suggest is that you give your therapist, determine that, you are looking for some assistance in one way, shape, or form, and mental health therapy is what fits, or at least that's where you want to start. Give your therapist a try a couple times, see how it goes. But that just because that person doesn't work for you doesn't mean there's not the right fit out there for you. Just like a medical professional, It's no different. If you are not aligning with what it is, it's in a super important relationship. And so being able to go, this just isn't working for me. And there are various different things I can understand that come with that of, do I want to tell my therapist, I don't want to work with you anymore.
Right.
This is not working for me. But I can tell you as a professional, as a provider, as a therapist.
You probably encourage that, right?
I do. Yeah. Please be honest with me.
And is it the same way? Like, have you ever thought like, you know what, I'm not the person for this patient, and let them know, say, hey, however you say it, but I'm not the person to help you? Part
of my responsibility is doing that, is being able to recognize if whatever it is, what have you, some of the treatment that I would suggest that I don't provide because that's not part of my training or not my specialty. It's not my scope.
But they need it, or you have an idea they may need it.
And being able to have that real honest conversation and say, hey, here's what I'm seeing is coming up, and this is what my recommendation would be. It's kind of the equivalent of your primary care doctor saying, hey, I think that you need to go see, a cardiologist.
Instead of saying, I'll try it. Let's see if I can figure it out. Right. You wouldn't want them to do that. Well, I think that takes a lot of integrity. I think that speaks highly of yourself if you do that and that's important part of your practice, because I think it's human nature to our ego kind of gets in the way of a lot of things. And so I think just because you're a professional doesn't mean you don't have that ego, but I think it's how you respond to that. And I think it goes the same way for any professional, really. I mean, am I technically licensed to handle a criminal case for somebody? Sure. But would you want me to?
Does that mean I should?
Probably not.
Right.
And should I? No, because obviously I'm not going to do the best I can for you and what you need. So I see the analogy, but I think sometimes a lot of people have problems with admitting that, hey, I'm not the person for you, or I can't do this, or I shouldn't be the one who do this for you. So I think that's good that you recognize that.
Well, and I think that those of us in this profession, we have had to do our own work to figure out that we're showing up in the best way possible, and that we're also, in sound and knowing what's in my scope and what's not in my scope. It might be in my scope because, my licensure, and this is what I do and what have you. That doesn't mean that I'm the specialist of that. So,
or that you feel comfortable doing it.
Yeah, I would love to be able to say, I want everybody, I'm the perfect fit for everybody. That's definitely not true. I know that's not true. And that's not just about me. That's true for any providers in the field.
So what is your fit? Do you have a fit? Do you prefer children, women, veterans, police officers, anything we've talked about, anything that kind of fits your...
I think that Yes, I love to work with veterans. I love to work with law enforcement. I love to work with kids. It's so hard to pick one over the other. It's perhaps I work best with certain symptoms, and, people usually find me because they've been referred for certain, subsect of symptoms.
What would those be, if you don't mind me asking?
Most often kind of going into the EMDR and stuff.
I was heading that way. Yeah.
Most often I always call it these cluster of symptoms. So it's like an umbrella. So the umbrella, I'll just be honest, is, PTSD.
Okay.
So post-traumatic stress disorder, right? Underneath that umbrella, there are 4 main categories of symptoms: depression, anxiety, sleep issues, sleep disorder, and pain, chronic pain.
When you say sleep disorder, does that mean inability to sleep, or could it also mean sleeping too much? Either one.
Yeah.
Sorry.
No, thank you. Those clusters of symptoms, right underneath that, there's symptoms that are consistent with depression, or symptoms that are consistent with anxiety or the like. I'm a neuroscience geek. I love to research and study and learn more and more and more. And my specialty happens to be EMDR, eye movement desensitization and reprocessing.
I'm glad you said that, because I was struggling before the show. I was like, how do I say that word? Okay, you said it.
And so with that, again, with it being my specialty, I really do use it for quite a few.
Well, first off, what is it? Because I think you're making an assumption that we know what that is, and unless you're you, most of us don't. So let's talk about what it is first.
Yeah. So eye movement desensitization and reprocessing is trying to think of how to put it in the shortest version. That I can. So it is a specific type of intervention or treatment that is geared towards bringing something, right, that shows up as immensely distressing or traumatizing. So most often, the EMDR was created to address trauma specifically.
To diagnose or to treat?
To treat.
Okay. So it's not a diagnostic tool.
No.
Okay.
And so there's all the things that go before that. So the diagnosis or what have you. And so then EMDR really targets the distress specifically using, so traditionally it's eye movements. The focus is no matter what type of, so it's bilateral, a dual attention bilateral stimulation is what it is. So what we're doing is basically, I know.
I'm pretty dumb, so we got to keep going.
So basically the idea, the theory behind it is you're taxing your working memory. And so what we know about memories in general, trauma, especially trauma memories, when a memory is called into the brain, into the hippocampus, so the place where, the memories come up, it can stay there for 5 hours, up to 5 hours. That means it's active for 5 hours.
And you're feeling the effect of that.
Perhaps, right? Because trauma is stored in the body. And so there's a great amount of distress that can come from that. And so EMDR takes the memory, and focuses the bilateral stimulation. So it could be tapping on legs back and forth, eye movements where the clinician guides with their fingers, follow my eyes, think about this. So it's pairing the thoughts and the actual movements, right? No matter what it is, dual attention stimulation. Mm-hmm. And essentially what happens is we go from 10 out of 10 freaking out. The goal is to go from 10 out of 10 freaking out to 0. Is
it effectively, I don't want to say getting rid of that memory, but removing it from that space in your head?
No, it's not like hypnosis. It's not hypnosis.
No. I guess I'm saying, you said you have a memory of a traumatic event, right? Mm-hmm. And you said, I think you said 5 hours?
Can last up to 5 hours.
Okay. So is this treatment in a way shortening the duration of that? Or am I missing?
It's not shortening the duration of it, but I guess, I could consider that could be a part of it. Okay. Maybe perhaps a better understanding. So during sleep, right, you've got REM sleep, so rapid eye movement. That's where EMDR is it's kind of rooted off of that. So during REM sleep, it is one of and there's a couple of different theories for why it works and the understanding of how the brain works. So one of them is rapid eye movement. And so when you're sleeping during that phase, we know that's when you're dreaming. And what I find in my own experience, but also in the literature and the studies and everything that went before this, is that that's the time that the brain is processing. The brain and the body are working together. I always call it's like a record player for me. So it's where when you have a dream, right, sometimes you don't even remember it. That's a typical part, right? But say you're having nightmares And those nightmares are like the record player just kind of gets stuck and it keeps trying to cycle. So it's trying to clean, right? It's trying to, play its method. And during REM sleep is the only time that both sides of the brain are online talking to each other. That's why dreams seem so out there sometimes.
Or so real sometimes too, right?
Or so real.
Yeah.
Because we're using the symbolic side of the brain as well as the black and white thinking of the brain, and we're merging them together. So during REM sleep, we're trying to heal. And during that healing process, something that has happened, perhaps a trauma or, an unsettling event, is keeping that record stuck. It's not able to play past that. It's not able to synthesize or heal up some of that. And we're not necessarily hardwired to be able to process an immense amount of trauma. Going back to EMDR, how EMDR uses the same idea behind REM sleep to get your eyes moving. There's all different kinds of, I could nerd you out on this all day. I really could. It's super fascinating.
Sounds like your specialty, right?
Man.
I mean, that's your...
I guess I should be,
right.
a geek about it.
Hopefully you are.
But so with REM sleep, right, both sides of the brain online at the same time. In EMDR, what we're doing is we're stimulating that same kind of thing. It's helping the brain move past where it's stuck to help to kind of synthesize. So it's essentially, it's not going to remove the memory. It's not going to remove the thought or even sometimes the triggers of it. It's going to remove the response. The goal is to bring down the response, right?
That memory triggers.
Yeah.
So it's like kind of like a process in a way. Normally your mind goes through this process and probably don't even think about it, but it happens every day. But when something extreme or traumatic happens, interrupts that process. And so the EMDR is hopefully kind of to repair that process or to get it.
Yes.
Okay.
That's
a
a
good
much
analogy.
better way to put it.
You explained to me so like an idiot like me can understand it, and then I just regurgitated it. So
Thank
wasn't
you.
anything
I
special.
appreciate that. No, I do. And I thank you for slowing it down for me too, because I get so tickled talking about it. And I feel like I just want to say, like, yeah, let me tell you about this really cool thing I learned. And most people are like, what are you even?
Well, if you were talking to someone, your peer, I would probably understand everything you said. But
Sometimes.
when you're, it's funny talking to professionals. They're so trained and specialized in one area that's cool if you're talking to someone else who's also trained and specialized in one area, but it doesn't necessarily work when someone's not trained in that area. I mean, I have that problem sometimes doing a trust for a client. I just blowing over things and like it's nothing. They're looking at me like, what are you talking about?
Yeah. Like, help me out. Yeah.
And I kind of forget like, oh yeah, not something to do. Or when I'm talking to a doctor sometimes, like, hey doc, remember, no med school here. Didn't go.
Right.
Help me out.
Right. And I try to remind myself that. And sometimes, yes, I do need prompts. And most often I'm watching as I'm explaining it. And usually I'm explaining it to my clients because I do want them to know. I want them to know they have choices. I want them to know if this is a recommendation because it's not always recommended for every symptom cluster or whatever. Making sure that my clients understand what this is, what the process is, what we're going to be going into, walking them through and educating, telling them what they can expect.
So are you like, do you have to get informed consent on doing that?
I do.
Okay. So are there any potential side effects of it?
So that's part of the informed consent process, right?
Usually
So,
that's why you have informed consent because of the side effects. But,
yeah. And that's...
or risks, I should say.
Yeah. For therapy in general, right? Risks and benefits. So, just as typical therapist that may not be using EMDR as a specialty, the informed consent with EMDR, the informed consent and the risks and benefits. The benefit is that we are working to address some of those targeted situations that, and it is, I don't want to say very scripted, but there's a protocol. And so you hit all of these stages and all of these phases in order to be able to reprocess that memory so that it doesn't come out as an 8 or a 9 out of, 10-point scale. Some of the risks or side effects, if you will, sometimes there are adverse reactions. There are abreactions. If your provider is a certified EMDR therapist, that means they've gone through extensive training. They've gone through consultation. There are so many different requirements. And I don't say that just on, behalf of myself, but for other, specialties out there. They've gone through the rigorous training. And so they'll know what to look for to be able to prevent that from happening.
But it is possible.
It is possible. Absolutely. Just like prescribing inoculations, right? Risks and benefits.
Sure.
One of the, sometimes too.
You don't mean vaccines, do you?
Talking about,
I'm not going to bring that up.
And I think I stopped using that as an analogy because people, and I get it. I do.
Yeah. I had to say it, but
Thanks for calling me out, Kyle. I appreciate it. But no, going back to risks and benefits and informed consent, again, that's why I have a conversation, and I don't expect somebody to answer me now. Do your own research. I have a page, resources here, look here. I tell them what to look for because I want it to be, not just a Wikipedia version of EMDR.
Right.
I want them to know where to look, the libraries that you can look in online. But yeah, sometimes when I use eye movements, people's eyes aren't used to doing that during the day. And again, EMDR, one treatment session of EMDR is the equivalent. So in REM sleep, typically we get between like 9 and 12 cycles of REM a night. Go into
ideally.
It. Yeah,
right.
Ideally.
Right.
Exactly. And with one EMDR session, it's the equivalent of about 20 cycles of REM. So you can get kind of sleepy afterwards. You're taxing your brain. You're taxing your working memory. You're with EMDR, we are making you do one thing while doing something, multitasking.
Do you get other benefits of REM sleep doing this? Such as, I know that's when that's when your body repairs itself, right? Your cells repair itself.
Yeah.
All these other things that physiologically happen in your body when you're asleep. Is that happening also when you do the EMDR?
That's one of the theories.
Behind. Heck, I might just try that for the
It's honestly, and because as an EMDR therapist does,
because anyone will tell you the most important thing in the world is sleep.
All the time.
Right.
I'm such a sleep nerd too. I tell people all the time, so how's your sleep?
Yeah. So if you have a way to mimic sleep, hell, sign me up. That sounds pretty good. Had someone do it to you?
That's one of the requirements.
Okay.
So it's very experiential. So this is something I had to undergo myself as part of the training, and it's very extensive training, and it's taken 3 years, so to speak, to get this as a specialty. But yeah, I had to undergo it. So which is really beneficial also, so that I can, I can only speak from my own experience,
Sure.
but I can understand what a client sitting in my chair, because I was the client sitting in the chair going through the training. And then afterwards, working with my consultation specialists, people who have been doing this for years, that I can seek guidance, but how they would coach me back of, okay, can you use your container for that? And I'm thinking, this is stuff that I do all by myself. It's been immensely helpful.
I think I cut you off when you were explaining something about the risk benefit, and I apologize. But it's not like when you get informed consent to a surgery, the anesthesiologist gives you informed consent and you sign off on it, because literally you cannot wake up from the anesthesia they're giving you. I'm assuming it's not that. Could your brain explode with it? Risk benefit. There's not. What are the risks? Like, we talking about headaches or?
So there are various different things that could happen. Headaches. There are, eye strain. There's all different kinds of things that could come with it. They talk about ab reactions in the literature, and ab reactions could be as small as physical stuff,
right?
But also that this could trigger something else that's going on. It could bring something else up that you weren't aware of.
Oh, so it could be a mental health, I guess, risk, in that it could bring up some stuff that you weren't dealing with before, but guess what? Now you are.
Chances are likely that's probably related.
Oh.
So if something else does come up, chances are likely that we touched exactly
what needed to be.
We just touched the leaves and the branches. We didn't touch the trunk or the roots. Potentially that's part of the roots. With a very skilled EMDR practitioner, they know what to look for. They know what they take their time. I focus on a resource. We call it resourcing in the field. It's like coping skills, right? The way that there's a lot of computer language that they use for EMDR, but we install them. So from a calm place to a container to securing your space where you are, how do you know you're safe? And creating those as tools and resources and naming them so that they're yours uniquely. We've taught your brain where to look for this. Yeah.
So to speak.
Where to look for this, and then how to activate it and to know when you need it.
Do you typically use this on people who have only had traumatic experiences, or is it something that is used for other purposes?
It can be used for all different kinds of purposes. Again, kind of going back to, it's so fascinating. But again, looking at depression, anxiety, sleep issues, and chronic pain, how they're using EMDR. And again, we're doing more and more research because this is an evidence-based practice. It's been around, Dr. Shapiro, I think, since the 80s.
Okay.
And so
4 decades now.
Yeah. And so they're finding out how this is actually a very helpful treatment for all different kinds of things. It's quite fascinating. That's why even within this specialty, there are specific specialists, people who specialize in, dissociative disorders, or they specialize in just the treatment of depression or attachment and how that manifests into our daily relationships in life.
That is so fascinating.
Tell me more.
No, it really is, because chronic pain, because pain doesn't necessarily always have to be physiologically consistent, right? I mean, obviously, if you have low back pain because a nerve is literally getting pinched off by vertebrae, that makes sense, right? But some people have low back pain and physiologically you can't see anything wrong. Is that what you mean by, like, it could be I don't want to say mental thing, but a mental thing, I guess?
Yeah, absolutely. There are various, and how the brain and body are connected. So there are physical sensations that are sent, the feelings that are sent up through the spine. They go into the brain, and the middle part of the brain, the insula, translates it. For instance, they have to bypass the amygdala, and the amygdala is a smoke detector of the brain. So it's alerted.
It's like you touch a hot stove. Okay, use that example, right?
Right. So I touch a hot stove. It is sending a sensation through my finger, up my arm, into my brain, and it's bypassing the smoke detector. That's the kind of the firefighter.
Get out of the way. Right. We're going past you.
Right. And the smoke detector is going to make a determination. Oh, okay. It is what it is. Right. So if the smoke detector is going off, it's because, right, it's taken a moment, it's taken a second to register with the brain, because it's got to bypass all different kinds of stuff to get to that part. It seems instantaneous, but if you've ever seen even a small child or had it happen to yourself, for me with a curling iron,
right,
I didn't recognize that it burnt until it burnt. And that's because, right, it takes a moment to process. And the amygdala, the smoke detector of the brain, goes off because there's smoke. Doesn't mean there's fire, but it's going to send out chemical messages that are going to go throughout, go throughout your body to pull your arm back. Don't leave your hand there.
That hurts.
It hurts. Ouch.
But does it really hurt, or is it the hurt?
The brain's translating it in the insula. And so we've got, right, so it goes up the finger, right, burn my finger, goes up the arm, into the back of the brain, through the amygdala, right, up to the insula. And the insula is going to slap on it, right? It's going to give it a narrative. What is this that I'm feeling? What's going on? And it's going to give it an emotion. And then the prefrontal front part of the brain is going to make the decision on what are we going to do about it? Is it a friend or a foe?
Right. Okay.
Yeah.
Oh, you can see my head spinning, right?
Yeah, tell me more.
So I've never even talked about this before. I mean, it feels like I've had mushrooms and I haven't had mushrooms. Is it arguably really not really pain in? Is it just a response that your brain is making up to tell you to do something? Is that why some people can like walk on hot coals? Because they're like...
trained themselves.
Yeah.
I would venture a guess, yeah.
So could you, in theory, can you get an example or think of an example where you can mimic a hot stove that's really not hot, but convince someone that it is so they get that same response to that, even though it's technically not burning them?
I imagine.
That's a trip.
It is.
I promise I didn't eat mushrooms. I promise. But I would love to maybe sometime have this conversation when they become legal. But what were we talking about again? I totally went off on a tangent there.
So pain.
Oh, yes. On the response to the EMDR. Okay.
And so with targeting pain, there are various different things that we can do for targeting the pain, but recognizing that sometimes I don't want to say that it becomes an addiction, but that your brain is going to pay attention to what you look at, what you're wanting to pay attention to. So if we're letting it just automatically pay attention to whatever, and it's noticing pain and pain and pain and pain and pain, you're kind of hardwired to see it.
Even though it may not be there?
Hardwiring yourself to see it.
Or it is there.
Yeah. It means that it's there, and now the brain is determining how high of a ranking we give it even.
But it doesn't have to be there. And that's kind of the idea of this therapy, right? I mean, that's what you're trying to fix.
So again, it doesn't remove it. It brings down the intensity of how you feel or think about it.
Kind of like take the edge off. Would that be a way to?
Maybe.
So I'm really intrigued by this, and I wish I knew more, because I feel like I'm not asking enough questions to...
They're good questions because a lot of people don't know.
Right.
A lot of people don't know therapy in general.
Right. I mean, this is all new to me.
And then we add the layer of, the EMDR, the components that come with that.
Right. I was thinking about this in preparation for interviewing you today, and that is that would it be accurate to say that a lot of people, a majority of people have, say, some mental health issues, but some are just better with coping as someone who maybe isn't as good as coping? Is that possible?
We learn coping skills. Like, how do we learn coping skills? What do we even know what they're called? Maybe
not, but I say some people are maybe learn coping skills through maybe their parents or their other friends or peers or teachers, and maybe someone doesn't have access to that, so maybe they don't have the coping mechanisms, but they're potentially could be suffering with the same issue as someone who does have those coping mechanisms. It's barking up the wrong tree here. No, it sounds a little bit like resilience. Yeah. And adaptability. Sure. And humans in general, we're pretty adaptable, pretty resilient. And you and I were talking earlier about my, 10 to 20 minute folder and my 30 to hour long folder. Color coded. I learned that myself through going through what were barriers for me
recognizing what worked for me. Most people, I would venture that they learn coping skills that same way. How do I get through this?
And some people can't get through this
Some people
by themselves. So therefore,
and I wonder,
the next step.
I always talk about Jenga blocks. You could have all the best coping skills in the world, and there's so many different things that go into it. But with Jenga, I'm talking about, have you played Jenga before where you pull the block out?
Yep.
Okay.
And eventually someone crashes it down.
And that's the part I'm talking about. How much top heavy can we take? I could be the most resilient person in the world.
At some point.
What happens? All of my coping skills, it doesn't mean that people aren't using all of their best tools, which I believe people are using all of their best tools to the best of their ability.
Unless there's tools out there that they don't know exist.
Exactly. And that's kind of where I come in.
Where you come in. Well, that kind of brought it full circle, didn't it?
Didn't it then?
So now I was going to get to the next question. What advice do you have to our audience who's listening to this and maybe have never thought of mental health themselves or for their family or their parents or children or kids or spouse? What message do you have for them to take away from this?
Well, I think there might be a couple of them. One is you're not alone. You might feel alone, but you're not. That if you're thinking about it, you're probably, I would hope and encourage you to trust yourself, to lean in, to find somebody that maybe, even if you do a web search for therapy in Bakersfield or whatever local community you live in, that you do a little search and you can find out. Some of them have little videos. Some of them have, a little snapshot of what their personality or their specialty is. And that can be really helpful. That also, right, our support system, our safety net, those are important factors of the individual. And I recognize that sometimes we are put in a situation that I want to talk to somebody, but it can't be my mom.
Right.
Because maybe it's about her. It can't be my sister because maybe it's about her. Maybe it's not. Maybe I just feel like I don't want to.
Uncomfortable, right?
Yeah. Well, and those people, it's important, right? They love you. They care about you. And that's great. But also recognizing sometimes I just need to bounce this off of somebody that doesn't have a buy-in into my immediate environment or my family, that they're most often people that are in your circle are going to take your side. And maybe that's not what you're looking for. You're looking for some real good, let's unpack this and figure out where we're going. And
good butt kicking.
Yeah. Well, and perhaps you've been kicking your own ass this whole time. You're recognizing it's not working and I don't like it. I don't like how it makes me feel. Again, you're not alone. There's help out there, and there are people that it's their mission and passion in life to be able to help and support in these ways.
I think this is an important question too, because someone who is listening who thinks that, okay, that is me or that's something I want to look into. Your services, not just you, but in your profession, are they typically covered by most people's health insurance? Is this something that you pay cash for? How does this typically work?
Yes.
Wait a second.
The answer is yes. So yes, typically because of, all of the work that went into making sure, mental health parity, that there is equal standing and availability for insurance coverage. That doesn't mean that it's always covered, that each provider is covered. Got it.
So it's just like health insurance in that sense. You could be covered here, but not here.
Right.
Okay.
Right. And so, you can get a listing from your insurance company of the providers that are in network. Sometimes insurances have amazing out-of-network benefits, meaning that another provider that may not
in your network, so to speak. Yeah.
That you can go to them, and usually you're using co-insurance, but it's a little bit more, but maybe that's the specialty you need. There are many different ways to use your insurance if that's the way that you want to go. And then, cash, of course. Mm-hmm. Sometimes there are sliding scales. So some therapists, they use a sliding scale based on your income. There's a whole, kind of rigmarole that they go through.
Formula that.
Yeah.
Sure. Okay.
To be able to, help. So yeah, there are many different ways to get assistance or have that funded, so it doesn't have to be complete cash out of pocket. Got it.
And I know some medical providers, same thing. Are you Medicare, no Medicare? Some do, some don't. What's your personal?
I would love to be Medicare, but there are specific guidelines that licensing requirements, and I have 2 of the 3, and the third one is the only one that they'll accept. So with Medicare specifically, licensed clinical social worker, LCSW, those are the providers that are able to be paneled. Unfortunately,
not an option.
Not yet. Still working.
Got it.
Still working towards being able to get some people some help from all of the different providers that are available.
Good. All right. Well, before I let you go, we always end it with a little rapid fire fun questions.
I know I forgot what I put too.
Well, the thing is she forgot to put them. So I've been thinking about the 3. So they're really going to trick you up because you haven't had a chance to think about it.
Okay, that's good.
So the first one I thought of, and I think I probably know the answer to it, is what is your indulgence?
Coffee.
Yeah, I knew you were going to say that because you came in with a huge cup and you talked about drinking all day. So I figured
it's not like I drink more than, I actually was asked the question by a professional the other day and I was like, actually, venti is 20 ounces. So I probably will reheat this like 3 times. So I'll drink the same cup of coffee just all day. I'm a slow drinker. Yeah.
Got it. So you're not drinking 3 of those a day. Okay.
No, definitely not.
Yeah. I stopped drinking caffeine about 4 or 5 years ago. And it was a trip. It really was a trip. At first, I was not functioning very well. But now I would never go back to it. It's just like one of those things I'm like anti. Yeah. It's kind of weird. I don't know why I mentioned that. But anyway, second question I have is what book do you recommend that everyone must read?
Honestly, it's funny because I was thinking about this yesterday, and it's the one book that I keep referring to anybody that will listen, and it's a book called Burnout.
Can you imagine what that's about?
Just the first chapter. If all you ever read is the first chapter, listen to it. I did the Audible version and then immediately bought the book because I like to write in my books. That's how I keep notes.
Keeps notes,
I apologize for whoever that offends. But in the first chapter, it is the 10 things that can help you close a stress cycle.
What's a stress cycle?
Waking up in the morning and then adding all kinds of stuff to it throughout the day. Most people don't recognize that we have to actively close that stress cycle. We have to give our bodies a signal. So for instance, when you leave here and you go home, right? What's the first thing that you do? Well, a handful of things that you do when you walk into the house.
Put my keys up, say hi to my wife and kids, maybe shower. If not, put my suitcase or briefcase up and just kind of get organized a little bit. I mean, how many is that? 3, 4?
Yeah. Well, and that's right. In the top, right. In the immediate needs.
Right.
And in the top 5 of those things that you just described, one of them is saying hi to your wife and kids.
Right.
That alone is one of the things that's talked about in this first chapter, but that we know when we've gone through a stressful, just day to day, sometimes it's residual. We've opened the door, it's open, and now what do we do, right? So way back in the day when we, lions, tigers, and bears running through the forest.
Fight or flight, yeah.
Yeah, then we come through the door and we close the door, and what happens? Family's there to hug us.
You're home, you made it, you're alive.
Yeah,
right.
And that gives our body a signal, oh, I'm safe.
Interesting.
So again, in this book, even if it, you buy it or come across it or share it with a friend, the first chapter, and it's got the 10 things that you can do. The description also, the descriptions throughout the book. I love, again.
It's articulate. Seems like
very articulate, but then it gives you actionable steps. These 10 things to do that you can do that are very simple, that you can keep in your back pocket. We don't always recognize that we need to close it, that we need to actively close the stress cycle, but that going for a walk, the act of moving forward can help us process through whatever it was, gives us the sense that, oh, I'm not freaking out because of whatever else happened. My heart and my body are doing this because I'm physically active right now.
So exercise, so to speak? I mean, is that one?
Oh, yeah.
I don't want to give away all 10 because I leave some people.
I want to turn it into a worksheet that I give people because I just think it's brilliant.
That's a good idea, actually.
Yeah, I will do it. I promise. It's on my agenda. It's just
your to-do list.
Yes.
You're huge.
Exactly. My 10-minute tasks.
Last question. One place and only one place. If you get to go on only one vacation ever again, where would it be?
Man, I get to go to one place and
that's it.
That's a really tough question. Been a couple of places. Honestly, I don't know.
You don't have to know. It's just questions.
I mean, I have always wanted to go to India. I've always wanted to visit.
Interesting.
India.
I have a friend who's gone twice.
Really?
And he just absolutely, it's a new world. He said it's amazing.
Yeah.
I have no desire to do that though. Because he has to take like all these medications and make sure you don't drink the water get sick type thing. I'm pretty comfortable right now in my house, but to each their own, right?
Absolutely. I think maybe that's why I love learning so much.
Yeah.
It's like a new adventure.
That would be a
time.
huge one.
I love people. I'm a fan. I like to learn more.
Do people watch?
I guess I do. I don't know. I think it's a natural, part of how we are as humans.
Yeah, some people are like really into people watching, like that's their thing. But you sound like you more people engage.
I'm more, I
Talk,
want to hear it. Tell me what's going on. How's everything? Like I'm not necessarily a people watcher. I don't think I really ever have.
All right. Well, thanks for coming in. It was very intriguing, and you can send me a bill for my services today. That I got a little tune up today myself.
That's awesome. Well, I thank you for having me. Honestly,
yeah, it was really fun, and I hope listeners can get something positive out of it. That's what we try to do. So
too. Yeah.
Nice to have you.
Thank you so much.
This show has been brought to you by the Law Office of Kyle Jones, Troy Burden with the Lynn Company, CPA John Duffield, Scott Hansen, real estate lender, broker, and investor, and Eckroth, LLC, a sales and marketing agency. You've been listening to the Our 2 Cents podcast. Check out the show notes for links and more information about the show. Also visit our website at our2centspodcast.com or check us on Instagram at Our 2 Cents Podcast. If you enjoyed this podcast, please subscribe.